When it comes to having a baby, some decisions are easier than others, like the decision about where to have your baby. When you have your baby at the hospital of the University of Pennsylvania, you have the security of knowing you're in the hands of specialists who are listed in the best doctors in America and Good Housekeeping's best doctors for women. Plus, the National Committee for Quality Health Care ranks our health system #1 in the nation for quality care. And U.S. News ranks PENN first in the Delaware Valley for obstetrics and gynecology. Plus, PENN's completely remodeled maternity floor offers the most modern labor suites in the city.
Our goal in developing this unit was to create a facility that would have a home-like atmosphere and yet provide the most advanced state-of-the-art technology for the care of the mothers and their babies.
The new maternity floor has 14 labor, delivery, and recovery rooms. It also features private whirlpool baths, magnificent skyline views, and comfortable family waiting areas.
And the rooms are huge, so there can be a lot of family support that can be with you during the experience. The other thing is that all the physicians and nurses are incredibly well trained. Neonatology and the pediatricians are a few steps away and are available for any kind of emergency intervention.
The labor, delivery, and recovery rooms are immediately adjacent to 2 fully equipped operating rooms for emergency and scheduled cesarean sections and other procedures. Here, the focus is on you and your baby. You are the most important part of the healthcare team, and we give you the support you need to make the best decisions for you and your baby.
Patients have complete control over their labor experience. If there is an issue or a problem, we will give them options.
Our childbirth education classes and breastfeeding support empower you to make the most informed decisions about the care of you and your baby.
The goal of the childbirth education classes is to include the mom and the whole family, to educate them so that they are prepared for whatever experience they would like, natural childbirth, anesthesia, and they feel that they have a big part of the decision making of how it's done.
One of the main decisions you will be making is the type of labor pain relief you will be using.
There's several options for pain management, and a woman that's laboring may opt for either breathing techniques and just concentration alone to deal with pain. There is narcotics, IV sedation available, as well as epidural anesthesia, which basically entails a catheter into the spinal column that releases local anesthesia and totally takes care of your pain.
Some women find so-called hydrotherapy or whirlpool therapy to be helpful, and that's one of the additions that this labor floor offers that our previous facility did not have.
Your newborn baby will be cared for in our normal nursery or newly constructed intensive care nursery, a level 3 facility with 31 bassinets. It is staffed by nurses who specialize in infant intensive care and doctors from Children's Hospital of Philadelphia, which is literally right next door.
Regardless of whether or not a mother goes to term and has a baby who has a small problem or has an infant born who has multiple problems and needs a great deal of care, we have the full staff to provide that in this institution. There's a few specialized cases where the baby will need to go next door to the Children's Hospital of Philadelphia. This is as complete a set of services as exists any place in the United States.
Your first hours and days with your new baby are special moments. At the Hospital of the University of Pennsylvania, you'll get all the assistance and support you need. Having made the choice to bring your child into the world at the Hospital of the University of Pennsylvania, you'll be confident that one of the first choices you made for your baby was one of your best choices.
It's genuinely a privilege to be involved in a patient's miracle of birth.
Probably nothing more exciting in medicine than bringing a new life into the world, and in obstetrics you get to do that as your job.